evening. My name is Barbara Mahundi and I'll be presenting models of health promotion. We are going to look at medical models and we're going to look at behavioral and social models. So medical models, these are models which are doctors, nurses, which use medicine and medical treatments to figure out what is wrong with people and make them better. The medical model of health promotion is really good at making people better when they are sick. It does not think about choices people make every day or the things around them that can make them ill. So what they normally do, doctors and nurses, their practice is more clinical. So we'll go on to look at behavioral change, and this is when it looks at one person, it looks at an individual, and it tries to encourage individuals to stop smoking and eating too much, like junk food, and also drinking a lot of alcohol, and also not exercising. So behavior change model promotion uses education and advice and health campaigns to help people make choices. So if I'm saying choices, these are the ways that they can do to stop these unhealthy habits, smoking, eating junk food, and also abusing alcohol. And moving forward, we are going to look at social model of health, and this looks at a certain area where a certain group of people, like a city, they look at a city and they look at how people live there, what they eat, the living conditions, if they are eating healthy, if they have decent jobs to be able to take care of themselves. So these things also include the social model, looks also at the income that the people have. And the social model of health promotion says that if we can make things better, then people will be healthier. I'll give an example. If there is a food outlet in a community and it only sells junk food, well, ideas can come up, like to educate the owners of the food outlet to also sell healthy foods gradually. So moving forward, we're also going to look at the comparison. We'll compare behavior change and social change model of health. So the behavior change of health promotion, they both make a very big impact in the lives of people in different ways. The behavior change model promotion looks at a person. It says people should make choices. For example, people should stop smoking and also eat healthy and exercise. The behavior change model health promotion says it is up to each person to make themselves healthier. So all that is done here is to encourage, it's not by force. So moving forward, the social model of health promotion looks at the things around people that can make them unwell. It says people may not be able to make choices, especially if they are from poor backgrounds or poor communities. In as much as they would want to live a healthy life, maybe they are limited with the income that they have, or others, they don't even have a decent job to afford to stay in a decent home or to have other basic commodities. So the social model health is to make a difference in communities, to make life better. We'll discuss that as we go on in the next slides. And behavior change of model promotion is about choices people make, and the social model it looks at a group of people. Then behavior change model, this model looks at one person. It sees poor health as mainly caused by individual choices, habits, lack of knowledge, It aims to change people's lives and actions through education, advice, rewards, or rules. Evaluation of the effectiveness of the behavior. It's simple to understand it. It uses easy to design programs like health leaflets, fitness classes, stop smoking campaigns. Clear target goals such as eat more fruit or do more exercise are easy to measure and check progress. Works well when people can change things and help when their barriers are also mostly lack of information or motivation. Quick results possible that change in knowledge or small habits can happen quite fast. So let's look at the limitations. The limitations, it blames the person and ignores the fact that people may not have money, time, or safe housing or good health care to make healthy choices. It is short-term success only that changes often and does not last if living or working conditions stay the same. It does not fix root problems and also does not deal with poverty, bad housing, pollution, and lack of jobs. It is less effective for people facing disadvantages. Education alone rarely helps those with fewer opportunities. And so we are going to look at evaluation of effectiveness of these models. It's a social model. Social model focuses on society and environment. It says health depends on things like housing, income, education, work conditions, transport, access to service. It aims to improve health by changing systems, laws, and surroundings, of which all these things, they take a very long time. So the strengths of the social model, it addresses real causes and targets wider issues such as low pay, poor housing, unsafe neighborhoods. It helps the whole community, benefits everyone, including people who struggle most with health problems. Fairer approach that does not blame people for their situation and aims to remove barriers to good health. Long-lasting improvement include better laws and services that create long-lasting healthy environments. And so we're going to look at the limitations of social health. It is slow and complex, especially in changing laws, housing, transport. It takes a lot of time and planning and money. It's hard to measure results as effects are seen over many years and are not as easy to count as individual habits. It needs cooperation and requires action from councils, government, the employers, and many groups, making it hard to organize. Less direct for quick personnel changes, meaning there will be less help for people wanting immediate advice of lifestyle support. So we're going to look at the overall effectiveness of both behavioral change model and social change model. Behavior change model works best alongside other work. It is great for teaching skills, building knowledge, but weak on its own because it ignores life circumstances. Social model is more powerful and complete for a long-term health improvement and reducing health gaps, but needs more resources and time. Best results come from using both together, helping people make healthy choices and making sure society makes those choices easy and possible for everyone. And so we're going to look at the aims and objectives of health campaigns globally. Those are the health promotion initiatives. The campaign wants to give people information, tools, and advice to help them make choices and be healthy. The NHS Better Health campaign wants to help people to be healthier by making choices, eating healthy, stopping smoking. So that is their initiative, and also encouraging exercising. Moving forward, we are going to look at their aim. The NHS, it helps adults across England to improve their health and well-being. It encourages small, simple changes that make real difference instead of big and hard to keep promises. It reduces serious health problems like heart disease, type 2, diabetes, cancers, and other long-term conditions. And as we continue, it also takes pressure off the NHS by stopping illness before it starts. Because right now there are a lot of people that needs medical attention in the NHS. It brings trusted health advice and free support together in one easy to find place. Moving forward, we're going to look at the objectives. It helps reach people healthy weight through better eating and more actively. For example, the 12-week weight loss plan. It gets people moving more with tools like couch to 5K and simple activity ideas for all levels. Supporting people to quit smoking for good with proven tips and helps. Help people drink less alcohol and understand the benefits. Improve mental well-being too, linked to every mind matters part of the campaign. Make all advice, apps and tools free, clear and easy to use online. Reach groups with higher health risks such as communities more affected by weight-related illnesses. So their strengths, it is easy. Free support offers trusted NHS resources, 12-week weight loss plan, couch to fitness, drink-free days, quit smoking tools, which are all available anytime online. It also uses clear and simple messages, focuses on small changes, make big difference, and is easy for people to understand and try. Reaches many people, works nationwide via websites, social media, and ads, brings other programs like Change for Life together in one place. It's proven results for users. Those who complete plans often lose weight or get more active. The average 2.7 kgs weight loss in 12 weeks. For users, more for those who stick with it. Extra partnership works with pharmacies and weight loss groups to widen help. It also relies heavily on digital access. All main tools are online at best, and it's harder for people without internet, phones, or computer skills. In the previous slides, we talked about the limitation of being poor and not having a steady income. So those are the limitations. It focuses on individual choices, seen as blaming lifestyle rather than fixing wider issues like expensive healthy food, poor housing, or unsafe places to exercise. High dropout rates. Many download apps to use, but as time goes on, they stop using them. So there is no consistency. Some criticize on messages, part felt too focused on weight and could upset people with eating-related worries or body image issues. They feel judged. Judged. Less help for deep-rooted problems. Does not fully tackle poverty, low income, or bad living conditions that make healthy living difficult. Moving forward, we are going to look at overall effectiveness of all that we have discussed. Good as behavior change tool, work well for people who already have resources, motivation, and internet access. Also helps build knowledge and skills. Not as strong as removing real-time barriers that work best when combined with better housing, cheaper healthy food, and safer neighborhoods. Not everyone can use the campaigns. Some people may not have internet, as we have just discussed, and may not have the funds to participate in it. So we are going to look at organizations that are playing a very pivotal role, like UK Health Security Agency, which protects public health from infections, chemicals, radiation, and environmental risks, mainly in England, with some UK-wide duties. Their strength is strong science-based, uses world-class labs, genomics, and data to spot threats early, like tracking COVID-19 variants or antibiotic resistance. Fast emergency response, acts quickly during outbreaks, spills or incidents, work closely with NHS councils and emergency services. They played a very pivotal role during the COVID-19 outbreak. Clear focus on prevention, runs monitoring, vaccines advice, and guidance to help stop problems before they spread widely. We're going to look at the strength, national and global role, leads UK-wide work on special risks like radiation and works internationally with World Health Organization and other partners. It supports the NHS, reduces pressures on hospitals through infection control, safer care standards, and preparedness plans. Expert advice provides trusted, clear guidance to government, professionals, and the public. So, the limitations, it focuses mostly on health threats protection. It is less involved in wider health improvements like obesity, housing, and poverty issues. Devolved boundaries mainly covers England, work in Scotland, Wales, and Northern Ireland is limited and can cause coordination gaps. When we look at political links, reports directly go to the government and sometimes seen as influenced by policy rather than purely independent signs. Limited reach into communities relies heavily on partners such as councils and NHS, less direct control over local action, and inequality works. So, also still building systems, newer organizations and some old structures from previous bodies, still being sorted, capacity gaps in some regions. Not responsible for all health, cannot fix wider social or economic causes of poor health, only hazards and risks with a specific role. UK Health Security Agency is very effective at spotting risk, stopping outbreaks, and protecting people from immediate dangers, exactly what it was set up to do. But it cannot solve every health problem, and it works best when paired with other bodies for support. If they could work with them as a team, they would improve their standards and also housing and everyday health for communities. So this is the end of my presentation. Thank you for watching.